As an osteopathic student, the values I've been trained in shape the way I approach patients in orthopedic surgery. One of the biggest principles is treating the whole person, not just the x-ray. In orthopedics, it's easy to focus on a fracture pattern or MRI finding, but I try to understand how the injury fits into the patient's overall function, lifestyle, and goals. Two patients can have the same meniscus tear, but the treatment plan might differ if one is a laborer who might need to kneel all the day versus someone who is primarily sedentary. That whole person mindset helps me tailor my recommendations to what truly matters to the patient. Another osteopathic principle I use is a strong appreciation for biomechanics in the kinetic chain. DO training emphasizes that structure and function are closely related, and dysfunction in one region affects another. I apply that constantly, whether I'm considering how hip weakness contributes to knee pain or how scapular mechanics influence shoulder pathology. It helps me think more broadly and make more accurate diagnoses, and it strengthens my understanding of surgical planning and post-op rehab. I also carry forward the hands-on diagnostic approach that osteopathic medicine emphasizes. Even though OMT isn't a core part of orthopedic surgery, the comfort with palpation, motion, testing, and detailed physical exams directly improves my ability to assess joints, soft tissues, and functional limitations. Finally, osteopathic medicine has ingrained in me the importance of patient-centered communication. Orthopedics can be intimidating for patients. There's a lot of fear around surgery, recovery, pain, so I focus on building a rapport, explaining imaging and procedures in simple language, and involving the patient in decision-making. That humanistic approach builds trust and ultimately leads to better outcomes. Overall, osteopathic values have given me a framework that blends medical and surgical decision-making with biomechanics, empathetic communication, and the whole person care. I think that perspective makes me a more thoughtful and well-rounded future orthopedic surgeon. Thank you.